I am Dr. Ramesh B, consultant laparoscopic surgeon and infertility specialist at Altius Hospital. So today I am going to speak about male infertility. So infertility, almost 15% of the couples in India are suffering from infertility, out of which more than half the cause of infertility is from the male side. So more than 50% of the infertility is due to male factors. So let us see what are the factors which can cause infertility because of male factor. So the first is the semen parameters. So the normal semen count should be 15 million and more than 60% motility, and at least more than 4% sperm morphology should be normal. So if any of these parameters are deranged, so we call oligoasthenoteratospermia. So the cause could be due to less count, reduced count, that is less than 15 million, something like say 10 million or 5 million can cause infertility. And motility, say 60% is the normal cutoff. So less than 60%, that is say even if it is 30-40%, can cause infertility. And morphology, anything less than 4% morphology can cause infertility. So this totally we call it as oligoasthenoteratospermia. So any of these three causes could be the cause of this thing. And another cause is the azoospermia. Azoospermia is total absence of sperms in the semen. So now what are the other causes of male infertility? So it could be due to sexual dysfunction and smoking, alcohol, and incorrect timing of the intercourse. They may be having intercourse when the woman is not ovulating, and chromosomal abnormalities, Y chromosomal microdeletion, cryptorchidism, that is undescended testis, and primary testicular failure, or torsion of the testis, varicocele, that is enlargement of the veins of the testis, can cause oligoasthenoteratospermia. And now first, when the couple comes, we investigate both of them, and when we find oligoasthenoteratospermia or decreased count, so we further evaluate the male factor by doing DNA fragmentation test, Y chromosome microdeletion, and karyotyping, etc. And we do scrotal Doppler test also to see whether if there is any varicocele. So if they have more than grade 3 or grade 4 varicocele, so that is an excellent case for varicocele ligation, which gives very good results in cases of varicocele. And if the sperm count is borderline, that is just less than the normal, then we will try to treat medically, that is giving antioxidants, clomiphene citrate, HCG injection, weight reduction. We will tell the patient to stop smoking and alcohol. So with all these measures, the sperm count may improve little bit. So suppose if the sperm count is less than 10 million or more than 5 million, so we assess whether this patient is suitable for artificial insemination or IUI. So in IUI, what we do is we stimulate the patient with medicines, and when the ovum is ready to rupture, and we take the husband's sperms and process it, and so that we pick up only the good motile sperms and inject into the uterus at the time of the ovulation. So normally we do 2 times injection for IUI, and IUI more than 20-30% of the patients conceive. Suppose if they don't conceive with IUI, the next step is the IVF, or in vitro fertilization, or ICSI. especially if the count is very less. So ICSI, that is intracytoplasmic sperm injection, is a very useful method where the sperm is taken in a micropipette and directly injected into the oocyte. So that will result in almost 60 to 70% of the pregnancies. So in the cases where there is azoospermia or severe oligospermia, so we can aspirate the sperms from the testis and semine vesicle directly, so that can be injected into that they are called PISA and TISA. So here what is happening is the sperm production is there in the testis, but the sperms is not coming out through the urethra. So in those cases, we take the sperms from the testis and do the ICSI and do the protocol. And suppose even after doing PISA or TISA, if we don't find any sperms inside, so what we do is donor sperms. So we take the donor sperms and do the IUI. So the most of these, and almost 80% of these patients conceive. So nowadays male infertility gives treatment, good proper treatment gives very good result for these patients.